Hello, my name is Emily D'Oliveira, and today I'm going to be presenting my critique on the research article, Breastfeeding Practices Among First-Time Mothers and Across Multiple Personalities. The purpose of this study was to investigate maternal characteristics associated with breastfeeding initiation and success. In the literature review, it was found that most medical and public health organizations recommend breastfeeding for all infants, with the goal being 6 months of exclusive breastfeeding. It is fiscally responsible to breastfeed. One statistic says if 90% of United States women breastfed exclusively for 6 months, the United States would save an estimated $13 billion annually on pediatric health care costs attributable to diseases whose risk is decreased by exclusive breastfeeding. Currently in the United States, only 74% of infants are ever breastfed. Breastfeeding is less common in women of lower income, Black race, and younger maternal age. Internationally, cesarean birth has been associated with decreased breastfeeding. One study suggests that breastfeeding initiation decreases as birth order increases. The Healthy People 2020 initiative set up targets, and 82% of infants should be breastfed at birth, with 61% still being breastfed at 6 months and 34% being breastfed until their first birthday. The research hypotheses for this study were rates of breastfeeding initiation would be lower for cesarean births versus vaginal births. Breastfeeding initiation would be consistent across all births for multiparas. A multipara is somebody who's had more than one child. And the goals are to identify maternal demographic and obstetrical characteristics associated with breastfeeding, and examine patterns of breastfeeding initiation across multiple pregnancies in multiparas. The research study that was used for this article is the Mother's Outcomes After Delivery Study, or the MOAD study. This was coordinated by researchers from Johns Hopkins University and the Greater Baltimore Medical Center. It's a longitudinal cohort study of maternal health after childbirth. All women who delivered at this Greater Baltimore Medical Center were given the option to fill out a questionnaire. It had to be 5 to 10 years after their first delivery. The questionnaire compares cesarean versus vaginal births. Recruitment for this study began in 2008 and is ongoing. Participants were identified from hospital discharge records, and potential participants were then screened by phone interview to see if they were still eligible. 858 women are ultimately enrolled in the study. 351 whose birth index or first delivery was a vaginal delivery, and 507 of those were a cesarean delivery. Next we're going to talk about the criteria for the MOAD study. The only inclusion criteria for this study was that their first child had to be delivered at the Greater Baltimore Medical Center 5 to 10 years prior to enrollment in the study. And the exclusion criteria only is for the index child, or the first child delivered. So the mother could not be less than 15 years old or greater than 50 years old. The delivery could not be before 37 weeks gestation. There could be no placenta previa, no multiple gestations, no known fetal congenital anomaly, no stillbirth, no prior myomectomy, and no abruption. The variables that were found in the data collected from the questionnaire were as follows. The only independent variable was breastfeeding mothers, and the dependent variables were women who successfully breastfed were referred to as successful initiators. Women who attempted breastfeeding without success were referred to as non-successful initiators, and women who made no attempt at all to breastfeed were non-initiators. The research variables for this study were mode of delivery, cesarean or vaginal delivery, labor induction, birth weight, women who had 3rd or 4th degree lacerations, emergency cesarean for fetal distress, assisted delivery by forceps or vacuum, maternal complications including blood transfusion, postpartum sepsis, and hospital readmission, race, maternal education, maternal age at delivery, and birth order, first, second, or third child, etc. The results of the study, in reference to demographics, were 72% of the participants were multips, 84% were Caucasian, 43% had a college degree, and 34% had a graduate degree. The median age was 32 years old. The factors they found associated with unsuccessful breastfeeding were African Americans, maternal education, birth order, cesarean birth, induction of labor, and postpartum maternal complications. The factors significantly associated with non-initiation were maternal education and birth order. Some research statistics. Breastfeeding was initiated with the first child by 91% of women with an 80% success rate. For subsequent births, 86% reported the same breastfeeding status for the second birth, and 83% reported the same status for the third birth. 95% of multips who breastfed their first child successfully reported successful initiation at their second birth, and 96% reported success with their third. 93% of the multips who did not attempt breastfeeding in their first child were non-initiators with their second, and 73% were non-initiators with their third. 41% of women who were unsuccessful at breastfeeding the first child were successful with the second pregnancy. Of the 95 multips who tried unsuccessfully to breastfeed with their first child, more than a quarter elected to not initiate breastfeeding with their second, and almost half chose not to breastfeed their third child. Mothers with less education than a college degree had twice the odds of not initiating breastfeeding compared to mothers who had a college degree. With respect to birth order, the adjusted odds of non-initiation with second birth was almost twice that observed in first births. Odds of non-initiation at subsequent births was almost 3 times that observed in the first birth. The odds of unsuccessful breastfeeding was 63% that reported in first birth. For birth order 3 or higher, it was 51% that of the first. With increasing birth order, women were less likely to initiate breastfeeding, but more likely to succeed if they did initiate. There were a couple limitations found with the study. First of all, the population being studied is relatively well educated and from a private hospital in a suburban setting. This sample may not be sufficiently diverse with respect to socioeconomic status. The use of maternal recall for breastfeeding and obstetrical events could be subject to recall bias. And this study did exclude certain obstetrical conditions such as anomalies, prematurity, and multiple gestation. So what does this mean for nurses? More targeted support and education is needed while patients are in the hospital during the postpartum period. All women, even those who are unlikely to breastfeed, should be targeted and given support and interventions for success. And the use of lactation consultants and community support groups has been proven effective in sustaining successful breastfeeding after discharge. The conclusions the researchers found: breastfeeding rates of multips could be improved through targeted support and intervention for pregnant women with an unsuccessful breastfeeding history. Cesarean delivery did not have a negative impact on breastfeeding initiation and success. Longer hospital stays associated with cesarean deliveries actually could offer more opportunities for breastfeeding support and education, which could potentially increase the success rate. Data regarding an association between breastfeeding and maternal race or age contradicted previous studies and may be due to the limitations we just spoke of. Further research is needed to establish whether breastfeeding promotion programs should be tailored to the needs of the unsuccessful population. This is a reference of the research article I did my critique on. Thank you for listening.